Are you tired of waking up with stiff, aching joints? Does climbing stairs feel like a mountain expedition? What if I told you that 3 simple vitamins could be the key to getting your life back? Stay tuned because today we're diving deep into the science-backed vitamins that can help relieve joint pain fast. Hey everyone, welcome back to Fit Life Junction. Today we're talking about something that affects millions of people worldwide: joint pain. Whether you're dealing with arthritis, general joint stiffness, or recovery from an injury, the vitamins we'll discuss today have solid research backing their effectiveness. So grab a notebook because you'll want to remember these. Before we jump into our top 3 vitamins, let's quickly understand what's actually happening in your joints when you experience pain. Joint pain typically stems from inflammation, cartilage breakdown, or both. Your joints are complex structures where bones meet, cushioned by cartilage and surrounded by synovial fluid that acts like oil in an engine. When this system breaks down due to age, injury, or conditions like osteoarthritis or rheumatoid arthritis, you get pain, stiffness, and reduced mobility. The good news? Certain vitamins can target these underlying causes. They work by reducing inflammation, supporting cartilage health, and even helping your body produce more synovial fluid. Now, I want to be clear, while these vitamins can be incredibly helpful, they work best as part of a comprehensive approach that includes proper diet, exercise, and medical care when needed. Alright, let's get into our top 3 vitamins. I've ranked these based on the strength of scientific evidence and how quickly people typically see results. Number 3 might surprise you. Coming in at number 3 is vitamin K2, and yes, this one often flies under the radar, but the research is fascinating. Vitamin K2 is different from the more well-known vitamin K1. While K1 is primarily involved in blood clotting, K2 plays a crucial role in bone metabolism and calcium regulation. There are several forms of K2, but the most studied for joint health is -7 Malawian kwacha. Here's where it gets interesting. Vitamin K2 helps direct calcium to where it belongs, your bones and teeth, and away from where it doesn't belong, like your soft tissues and joint spaces. When calcium builds up in the wrong places, it can contribute to joint stiffness and pain. A 2017 study published in the journal Nutrients found that people with higher levels of vitamin K2 had better joint health and less inflammation. Another study from 2019 showed that K2 supplementation helped reduce joint pain in people with osteoarthritis over a 12-week period. The effective dosage in studies ranges from 90 to 180 micrograms daily. You can find K2 in fermented foods like natto, certain cheeses, and egg yolks from pasture-raised chickens. However, most people find it easier to get therapeutic amounts through supplementation. Most people start noticing improvements in joint comfort within 4 to 8 weeks of consistent use. Moving up to number 2, vitamin C. Now you might be thinking, isn't that just for immune support? Well, prepare to be amazed by what this vitamin can do for your joints. Vitamin C, or ascorbic acid, is a water-soluble vitamin that's essential for collagen synthesis. And here's the key: collagen is the main protein in your cartilage, tendons, and ligaments. Without adequate vitamin C, your body literally cannot repair and maintain these crucial joint structures. Multiple studies have shown vitamin C's power for joint health. A landmark study from the Framingham Osteoarthritis Cohort Study, which followed over 600 people for 8 years, found that those with the highest vitamin C intake had a 70% lower risk of developing knee osteoarthritis. But it gets better. Vitamin C is also a powerful antioxidant that helps reduce inflammation in your joints. When your joints are inflamed, free radicals cause additional damage. Vitamin C neutralizes these free radicals, breaking the cycle of inflammation and pain. When you take vitamin C, it goes straight to work in several ways. First, it stimulates the production of collagen, which helps rebuild damaged cartilage. Second, it reduces inflammatory markers like C-reactive protein. Third, it helps your body absorb iron, which is necessary for healthy connective tissue. For joint health, studies suggest 500 to 1,000 milligrams daily, divided into 2 doses since vitamin C is water-soluble and gets flushed out quickly. The best sources are citrus fruits, berries, bell peppers, and leafy greens, but supplementation often provides more consistent levels. Many people report feeling less joint stiffness within 2 to 4 weeks. For more significant improvements in pain and mobility, give it 6 to 8 weeks of consistent use. And now, our number 1 vitamin for joint pain relief, vitamin D3. This one takes the top spot because of its incredible versatility and the speed at which people often see results. Here's a statistic that might blow your mind. Studies show that up to 80% of people with chronic joint pain are deficient in vitamin D. That's not a coincidence. Vitamin D3 is actually a hormone precursor, not just a vitamin. It has receptors throughout your body, including in your joint tissues, muscles, and immune cells. This is why it has such a profound effect on joint health. Vitamin D3 works through several pathways. First, it's essential for calcium absorption. Without it, your bones become weak and put extra stress on your joints. Second, it directly reduces inflammation by regulating immune cell activity. Third, it helps maintain muscle strength, which is crucial for joint stability. The research on vitamin D3 for joint pain is extensive. A 2016 systematic review analyzed 24 studies and found that vitamin D supplementation significantly reduced joint pain, especially in people who were deficient. Another study published in the Journal of the American Geriatric Society found that people with adequate vitamin D levels had 70% less joint pain than those who were deficient. For those with osteoarthritis specifically, vitamin D3 has shown remarkable results. A 2013 study found that people with knee osteoarthritis who took vitamin D3 supplements experienced significant improvements in pain and function within just 12 weeks. Here's what's crucial: dosage matters and it's highly individual. Most experts recommend getting your vitamin D blood level tested first. You want your 25-hydroxyvitamin D level to be between 30 and 50 nanograms per milliliter for optimal joint health. Most people need between 1,000 to 4,000 IU daily, but some may need more. This is where vitamin D3 really shines. Many people start feeling improvements in joint comfort within 2 to 4 weeks, with maximum benefits typically seen at 8 to 12 weeks. Now here's where things get really interesting. These three vitamins work even better together. Vitamin D3 helps you absorb calcium, vitamin K2 directs that calcium to your bones, and vitamin C helps build the collagen matrix that holds everything together. It's like a perfectly orchestrated symphony for your joint health. So how do you implement this? Start with vitamin D3, get tested and begin supplementation based on your levels. Add vitamin C next, as it's generally well tolerated and works quickly. Finally, incorporate vitamin K2 for long-term joint health and calcium regulation. A few important notes: always consult with your healthcare provider before starting any supplement regimen, especially if you're taking medications. Vitamin K2 can interact with blood thinners, and high doses of vitamin C might cause digestive upset in some people. Remember, vitamins work best when combined with other healthy habits. Regular gentle exercise, maintaining a healthy weight, staying hydrated, and eating an anti-inflammatory diet will amplify the benefits of these vitamins. To recap the timelines, vitamin D3 often shows results in 2 to 4 weeks, vitamin C in 2 to 6 weeks, and vitamin K2 in 4 to 8 weeks. Be patient and consistent. Joint health is a marathon, not a sprint. So there you have it, our top 3 vitamins for joint pain relief. Vitamin D3 takes the crown for its rapid results and multiple mechanisms of action. Vitamin C comes in strong at number 2 for its collagen building and anti-inflammatory properties, and vitamin K2 rounds out our top 3 with its unique ability to optimize calcium metabolism. If you found this video helpful, please give it a thumbs up and subscribe for more evidence-based health content. Have you tried any of these vitamins for joint pain? Let me know in the comments below. I read every single one. Remember, joint pain doesn't have to be a life sentence. With the right nutrients, lifestyle changes, and professional guidance when needed, you can get back to doing the things you love. Here's to healthier, happier joints.